Okay, before you start your central line dressing change, you need to make the decision of whether your patient's going to be able to turn their head to the side or not. If they can turn their head to the side and away from the dressing and keep it there for you and you trust them to do that, they don't have to have a mask. Otherwise, get a mask and put it on them before you start the process. Then you're going to go ahead and open up your central line kit after you've done hand hygiene. And you're going to go ahead and don your mask. Then you're going to go ahead and put on a pair of clean gloves. And you're going to remove the old dressing. It's nice to have a buddy just to kind of help you make sure that that line does not migrate out of place if you can. That's best practice. Once that dressing is removed, you go ahead and take off your soiled gloves. Do hand hygiene with the hand sanitizer that's in the package. You can go ahead and open up your kit. You want to make sure you open up away from you first, always, to maintain sterile technique. And lastly, the edge towards you. Go ahead and remove your sterile gloves with one hand. And go ahead and apply them away from the blue sterile field. Making sure you use sterile technique when you put those gloves on. Then you're going to go ahead and open up your CHG. And you're going to make sure you click that thing's open, give the fluid a chance to kind of go to the bottom, and then you're going to scrub. And this is where your friend might come in and help hold in place. Otherwise, just make sure you're not allowing that catheter to migrate at all. Make sure that you let that CHG dry really well before you get ready to put your dressing on, because if you put that dressing on over wet CHG, it will break your patient's skin out. And you may think then that they have a CHG allergy when they really don't. Make sure you kind of get under that dressing good too. And discard your CHG. Then you're going to have a package of barrier. When your CHG is dry enough, and I wouldn't pick this back up, I'd go get another kit that you're going to wipe around. And then you are going to go ahead and apply your dressing. You want to make sure that this yellowish spongy area is centered over the dressing, and you also want to make sure that then the tubing comes out one of the notches. Try to get it down without any bubbles or creases. And then you're going to go ahead and remove this portion of the dressing. Make sure it's pressed down firmly as you do. Get out all your little wrinkles and bumps so you have a nice airtight seal. Then you're going to take this dressing and you're going to get it put underneath. And one kind of easy way to do that is to loosen the one side a bit and go ahead and put it down this way. And then bring this actually under and go ahead and smooth it on down that way. And then to finish out your nice, pretty occlusive seal, you write your date and your time on this piece of tape. And the last step is then to put it over and seal everything up all pretty and tight. And then the final step is to take your tape measure that's in the kit and measure your dressing from the insertion site, or your catheter from the insertion site all the way to the end of the hub, and document that in epic.